It's time for Morton in the Morning on WVBF, a weekly get-together with your friends at Morton Hospital. Coming to you every Wednesday at 11:05 a.m., Morton in the Morning brings you full access to the latest hospital news and health information. Stay in the know about important health and wellness topics, new doctors and services, and upcoming events, and get to know the team at your community hospital. And now, Morton in the Morning.
Good morning, everyone, and welcome to this week's episode of Morton in the Morning. It is Wednesday, January 18th. I'm your host, Julie, and we are coming to you right here from Morton Hospital, your community hospital in Taunton. And we are very excited to be joining you today with a brand new show. So I know that for the past few weeks, we've done some reruns. We've revisited some older interviews that we had done, and we did sort of an end of the year best of Morton in the Morning recap throughout December. So we, again, are coming to you live today with a brand new show, and we hope everyone enjoyed their holidays and so far is enjoying the new year. So today we are talking all about our open positions here at Morton Hospital. We are hiring, and we have a lot of great opportunities available to our community, and we have a big hiring event coming up. So two of our guests today are managers of two of our departments. One is the imaging department and one is the laboratory. And we're talking about positions specifically in those departments, but we'll certainly highlight the many other positions that we have available and that we will be hiring for at our hiring event. So our hiring event, it is a walk-in hiring event, but we also encourage registration in advance. But again, walk-ins are welcome. So this hiring event is going to be on Tuesday, February 7th, and it is for all open positions at Morton Hospital. Over the last couple of weeks, we've actually done some nursing-specific hiring events, but this one on February 7th is for nursing and all other ancillary department positions. So anything from nursing to CNAs to unit clerks on our patient care floors, to admitting clerks, to housekeeping staff, to food service aides and hostesses. So we've got a lot of great positions available. And again, the hiring event is Tuesday, February 7th. There are two sessions. One is 9 a.m. to noon, and the second is 2 to 4 p.m. And again, it's right here at Morton Hospital, 88 Washington Street here in Taunton. And you can come on in and enjoy an on-the-spot interview with one of our managers, whatever position you are interested in. That manager will be here to interview you and talk to you a little bit more about the position and the qualifications, and maybe even extend some offers on the spot. So we hope you will join us. We do, for nursing positions, new nursing graduates are welcomed, and we do have some sign-on bonuses available for new staff RNs. We also have a great incentive for nurses who join our float pool. So float pool nurses, they sort of travel to various areas of the hospital for their different shifts. And if you join our float pool, if you're a new nurse at Morton Hospital, you earn an additional $7 per hour with a float pool nursing differential that we have in place here. So great incentives to join our team. Again, it's a walk-in hiring event. We only ask that you bring an up-to-date copy of your resume and be prepared to interview with someone while you're here, and masks will be required at all times. Other than that, we hope you'll join us. So please spread the word. Any family, friends, neighbors who are looking for a career opportunity. Oftentimes people think of careers at Morton Hospital as, nurses and doctors, but there are so many careers available here. We have imaging techs, mental health associates, patient safety sitters, which are people that really sit with patients in the room or outside of the room to ensure their safety. We have pharmacists, phlebotomists, and so many more. So I want to get right into our guests today because they are going to talk about some of those specific positions in our imaging and lab department. All right, so first up today, we have Stacy Velasquez. She's actually no stranger to our show. I think you've been on once or twice before,
Sure
and we've
have.
talked about, some things in our imaging department because you are the operations manager. Is that your title?
Correct.
Okay. So tell me what you do as the operations manager.
So pretty much I do the daily, everyday stuff. We do payroll, we check on patient schedules and tech schedules. I'm responsible for all of the imaging modalities, CT, ultrasound, nuclear medicine, x-ray, mammography, MRI. So I overlook all of those departments.
Okay. So that's a lot of areas. I hope you have help. You do have some section heads in different areas.
Right.
And then we also have, the imaging areas offsites too. So tell me about those.
So we have Northwoods that has radiology. They take walk-in appointments. And then we also have Middleborough over on West Grove. They are x-ray and mammography, and they also take walk-in x-rays and walk-in mammograms.
Okay.
Screening mammograms.
Great. All right. So I know that the imaging department, you do so many different types of diagnostic tests, etc. We could talk all day about those, but today we're really focused on our hiring event, which we are really excited about. Again, it's on Tuesday, February 7th, and I wanted to have you on because we have various imaging tech positions. So let's sort of walk through those, talk about what they do, and then maybe people listening out there will better understand if they are qualified, what they need to do to be qualified. So let's start with the first one on the list, which is a CT tech. So tell me about what a CT tech does.
So CT or CAT scan tech, this position is actually a day position. It has weekend obligations, holiday obligations. We have a great team over there. We run 24 hours a day. Our shifts vary. Some are 7 to 3:30. We have 3 to 11. We do 11 to 7. Of course, there's call. Great team. They work a lot of, we do all of the ER patients and we do all outpatient procedures that are scheduled.
Okay. And what is a CAT scan or CT scan? What would you need to do that for?
Oh, that could be anything from, abdominal pain, or if you were in a car accident or fell. They do, a lot of physicians will order head CTs or neck CTs. It's a great diagnostic test with a quick turnaround for imaging and reading here at the hospital.
Okay. And you also play a big role when we have patients coming in with strokes, right?
Correct.
Okay, because I know you need an immediate CT
program
done.
Here. Yep. So we have a huge stroke program here. When patients present with stroke symptoms, there's actually a time range in which we need to have the CT scan done. So that we can see a better outcome for the patient. We have a whole program here. We follow all of our patients from door to CT to treatment. And then everything is reviewed month to month to make sure that we're within those limits.
And they're very fast, those CT techs. When we need them, they are there because we do the code stroke overhead and everybody responds so we can get to those patients in a timely manner. So if you're just joining us, to our listeners out there, we have a great show today. It is about our hiring event coming up on February 7th, and we have a lot of great career opportunities here. Right now we are sitting with Stacy Velasquez, and she is the operations manager for our imaging department, and we are talking about a lot of the great opportunities that she has. Right now we are talking about the CT tech or the CAT scan tech, and I have a lot more questions for Stacy, and then she's going to talk about a few other positions that she has open that they are looking to hire into the department. But first, unfortunately, it's time for our first break. So we were going to be right back after these short messages with more with Stacy talking about the imaging careers available here at Morton Hospital. Before we break, I do want to remind our listeners how you can contact us here at Morton in the Morning. You can send us an email anytime, 24/7 at mortoninthemorning@steward.org. That's MORTON in the morning at STEWARD.org. We would love to hear your feedback. Are you enjoying our show? Is there any topics that you would like to hear about moving forward so we can line up some guests and talk about what you want to hear about? So give us an email anytime. We'll check it and we'll get back to you in as soon as we can. So again, time for our first break, and we will be back with more about our show, highlighting our hiring event and career opportunities here at Morton Hospital. We will be right back.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
Need a primary care provider? Morton Hospital and Steward Medical Group have welcomed 3 new doctors to our community. Dr. Margaret Sywinska and Dr. Yelena Levin have joined our Steward Primary Care of Taunton practice located on Bay Street. For an appointment, you can call 774-501-3229. And Dr. Joanne Sylvia is now seeing patients at Steward Primary Care of Lakeville, seeing patients of all ages. For an appointment, call 508-947-4400.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Good morning, everyone, and welcome back to Morton in the Morning. I'm your host, Julie, and today we are talking all about career opportunities here at Morton Hospital. We have a big hiring event coming up on Tuesday, February 7th, which we are really excited about because it is for all open positions at Morton Hospital. Now, today we are highlighting a few specific positions. Right now we are here with Stacy Velasquez. She's the operations manager for our imaging department, and we are talking about 4 of the careers that she has available right now in her department and with her team. So before we took our break, we were talking about the first position, which is a CT tech or a CAT scan tech, and really just talking about what they do in the department. All right, so the CT techs, what are they operating like a piece of equipment? What is that?
Yep, so they actually operate the CT machine.
Mm-hmm.
It looks like a big donut on its side. Your head sticks out of the other end, or your feet, depending on how you go in. The scan itself, from when the patient gets on the table to getting off the table, is could be anything from 3 minutes to 5 minutes. Sometimes you're asked to drink contrast. Sometimes you're asked not to drink contrast.
Yep.
Sometimes patients are injected with contrast. A lot of people, if you've ever had CAT scan, they'll feel like, oh, you're going to get injected with this, and it makes you feel nice and warm. It's just the contrast entering into the IV and then into the person's body. Depending on what your doctor orders and your symptoms, depends on whether you're going to drink contrast or get an IV contrast or not get contrast at all.
Okay. Now, does the CT tech manage that process too, or are they just in the room operating the CT machine?
Oh, no. They they do it all. So the CT techs will look at their schedule, look at the orders that they've received for the day, and make sure that the reason that the exam's being ordered is the correct exam we're doing.
Okay.
So they still manage that part. If they have any questions, we have radiologists on call here on site that we can ask those questions to.
Okay.
Patients that are having IV contrast, we always look to see that they've had labs done within the 30 days of the scan. So we want to make sure that their kidneys are working and that their levels are within limits so they can have that IV contrast injection.
So they pretty much manage the whole process for the patient.
Correct.
Up until where the image is sent to the radiologist to read.
Right.
Okay. Right. Now, what sort of qualifications are required for a CT tech?
So all CT techs have to have their certification by the AART.
Okay.
And that's a national certification. And so they'll have to take boards and all that. And then there's also a state license that they have to receive by the state of Massachusetts.
Okay.
If they have their state license and they have their AART and a current BLS, they can apply.
Okay. And so someone would actually have to go to school to be a CT tech. It's not something you could say, oh, I'd like to be a CT tech and take a test and get training.
Correct.
Okay.
Yeah. Yep.
All right. And I'm guessing it's probably the same for the rest of the positions here too.
Correct.
But imaging is such a growing field. There's probably a lot of techs out there. And if you're looking for a new opportunity, we certainly have them. So next on the list is an MRI tech. So tell me about how MRI is different from CT.
So MRI, the images are required using a magnet. And in CT, the images are required using radiation. So you're not going to be receiving any radiation dose when you have an MRI, but there's still a whole nother level of safety with MRI because of the magnet. The magnet is always on. It doesn't ever shut off. So we have a very lengthy screening process for both the techs and the patients or any visitors coming into the zones. You'll see some of us around the hospital have these like little red stars on our badges saying that we've been cleared for MRI, so we can respond to a code or a rapid response or anything like that in that department.
Okay.
So the MRI position is a per diem position, which means that, you can kind of like pick up shifts throughout the week or throughout the month. Myself and the section heads do a really good job of trying to send out all the shifts that we have that are opened to kind of give the staff an overview of what's opened and what we need and what the needs are, the operational needs are for the department.
So that's a great opportunity for if someone already out there is the MRI tech, maybe they have a part-time position, or, if they are full-time somewhere else, they're looking for even more hours.
Right.
Because we do have a per diem commitment, right? So they should give availability for at least, is it 2 shifts a month, including a weekend shift?
Right.
Even if they're not needed for those, but having that availability would be important for that role. Okay, so MRI tech, same thing. They have to go to school for it. They have to have certification.
ART, the state of Massachusetts does not have an MR license, but we do verify all MR certifications through the ART as well.
Okay. All right, and then the next one was rad tech. So you have 3 on the list. So what's the difference with a rad tech? What is a rad tech?
So
what do they do?
Rad tech or X-ray tech, same thing. We have 3 positions right now. We have evening. We have some day positions, and then we have a per diem position. So the per diem's kind of the same, like we just talked about the MR tech. They give us, we give them what our open shifts are and what our needs are, and they let me know what they can work.
Okay. So a rad tech they do X-rays specifically.
Correct. So they'll do X-rays here. Either in fluoro, where they do like the live drinking, watching people drink barium. We have 2 rooms in the ER where we do all of our ER patients and our outpatients. And then we have a room here in the main also that we can do our inpatients. We also have 2 portables that go up on the floor and do patients that are either too sick to come down, unable to come down to the department. We have all digital imaging.
Yeah.
Our X-ray techs are kind of all over the place. They'll be in the OR during, certain surgeries. They're a busy bunch.
Okay. And they definitely work with some really cool equipment. I mean, I've seen a lot. And our newest machine is probably what, the MRI machine?
No, our newest machine in X-ray is the it's room 3, the fluoro machine.
That's
that we just had replaced.
Yep.
For the bariatric fluoro machine.
Okay, I remember back when we first got our new MRI machine. That was really exciting because it's how do they describe it? It's more of an open concept.
Yeah, it has a larger,
it's a wider bore
larger
that you
bore,
go into.
Right. So we're able to accommodate more patients. Patients that are claustrophobic are less claustrophobic in a large bore MRI.
Nice. Okay, awesome. And then the last position is an ultrasound tech, and I think that's just one open position that you have right now.
It's a full-time ultrasound tech position. Ultrasound techs acquire the images using high-frequency sound waves. A lot of people think of ultrasound and they think of, babies having an ultrasound to see if you're having a boy or a girl. But ultrasound actually does a lot more than that. We can look at the blood moving through your vessels. We can look at your liver. We can look at your gallbladder. We look at much more than how many months the baby is.
Okay.
This position that you're talking about was actually a full-time position. It's got weekend obligations and holiday obligations as well. Again, we have a great group over in ultrasound, a lot of years of experience over there. We do have 2 newer grads, but they came over and they've been doing great over there and kind of just really made the team.
Good. So as long as you graduate, you have your certification.
Right. In ultrasound, it's a little bit different. So ultrasound, you get your registry and all the different things you can image. So you can get your registry in OB, you can get your registry in vascular, you can get your registry in abdomen. This job, we're just asking for any registry that you have, and then we have, we'll provide, the protocols and what we need, and just go from there.
Okay. So for all these positions, they already have their certification and or license if it requires that. So what's the onboarding process? I mean, do they still have to go through an orientation here? Because I'm sure there's many things here at Morton Hospital that might be different than elsewhere. So what does that look like for these folks when you first onboard them?
Correct. So once they come in, sometimes they'll do a telephone interview or an in-person interview or do both. I kind of bring them around and show them the department they'd be working in and show them even just the lay of the land around here.
Yep.
And then, I'll we decide we're going to make an offer, and then HR usually, will reach out to them, give them, the specifications of the job and what the requirements are. Within, I would say it takes about 3 weeks.
Okay.
Maybe a little bit longer.
So that's like the
to
training
get them,
period?
Yeah, well, to get them onboarded in here. And then they get the orientation date. And then once they're oriented, we really gauge it by the tech.
Yeah.
We have competencies that need to be fulfilled, and they work with the tech. We have check-offs to make sure that they're meeting all the needs, and if they have any questions, or is there anything that they need help with?
Sure.
There's a way of us tracking all of that.
Okay. All right. Because obviously, if they've gone to school, they have the certification. They're already trained to do the job. It's just learning the little things here at Morton and making sure that they check off all the boxes and are able to perform it unsupervised, right? Mm-hmm. Okay. So what types of candidates are you looking for?
Well, we're just looking for someone to, be a good fit for the team. A team player, patient, safety, centered, patient satisfaction centered. Mm-hmm. We're a little family. There isn't many of us. There's probably, across all the modalities, there's probably about 80 of us. But when you look at how many patients we see in the one day with that much staff, so we really need people that are flexible and can kind of, bob and weave through the day. We have a lot of add-ons that come in, people through our emergency room, and those patients need care as well, and, need imaging, and we need to be available for that.
Okay, well, it's definitely a great team. You can tell that your teams are very, close-knit, and they also seem to have, fun throughout the day also. And one thing that I will say is if you're out there, you're qualified for any of these positions, Stacy and the management team and imaging, they always do a great job with engaging their employees, doing fun things, celebrations throughout the year. So it's definitely a great place to work. So anything else you'd like to add, Stacy?
No, I hope to see you and make you a part of my team.
Yeah, and you'll be there on the day of the hiring event.
Correct.
To interview on the spot, right? Okay,
right.
Perfect. So we just ask people to bring a copy of their resume. You can sign up online in advance, or you can walk in. Either way, we'll have a bunch of managers here to interview for all of our open positions. So thank you so much, Stacy. That was Julie. A lot of great information.
Bye.
All right, well, that wraps up our first interview for today. Thank you so much to Stacy for joining us and talking about those great career opportunities. Again, she mentioned CT tech, MRI tech, X-ray tech, and ultrasound tech. Awesome career opportunities here at Morton Hospital with an awesome team as well. I can certainly attest to that. So we are going to have another guest for the second half of our show. Her name is Judy, and she is our Director of Laboratory Services because she's got some great opportunities there as well. And again, today we are promoting our career opportunities and our big hiring event that we have at Morton Hospital. It's an in-person hiring event on Tuesday, February 7th. 9 a.m. to noon and 2 to 4 p.m. It's right here at Morton Hospital. Walk-ins will be welcome, but we also do encourage registration in advance. And how you can register for that, hopefully if you follow our Facebook page or if you can search our Facebook page, you will see a registration link there. You can also find our event posted on Indeed. But the best way is to go to our Facebook page because we have shared the link there. You can click right on it and get to the registration page. You can select which time you want to come to the hiring event, which position you are interested in, and that really just lets us know you're coming so that we can expect you. And again, we're going to have all of our managers here for each position. They will be on site and ready to conduct on-the-spot interviews with you. So anyone out there listening, we've got some great opportunities, and we hope you will join us for that February 7th hiring event. So we are now halfway through today's show, and that means it's time to take our second break. So we hope you'll join us and keep listening about the additional career opportunities in our laboratory department. And then toward the end of our show, as we usually do, we'll share a few hospital updates. So stay with us. We'll be right back after this short break.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
At Morton Hospital, we're proud to be nationally recognized for quality and safety. In addition to recently achieving the Gold Seal of Approval and accreditation from the Joint Commission, the Leapfrog Group has named us as a straight A's hospital for having received 5 consecutive A hospital safety grades since 2020. To learn more about our achievements and awards, visit mortonhospital.org.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Good morning, everyone, and welcome back to the second half of today's Morton in the Morning show. Thank you so much for listening. We're glad to be joining you today with a brand new show for the new year. Today we are talking about our hiring event that we have coming up on February 7th. It is for all open positions here at Morton Hospital. We are really excited and we are hoping that that will be well attended and that we will get a lot of great candidates from our community because we know they're out there. So if you're looking for a new career opportunity, any family or friends are looking for a career opportunity, we've got a lot of amazing opportunities here. Not only nurses and CNAs and other clinical staff, but also ancillary staff positions like unit clerks. You know, you work up on the unit, but you're not necessarily taking care of patients. We have pharmacists, phlebotomist positions, patient safety sitters, admitting clerks. We have security officer positions, interpreter positions. We have mental health associate positions. We have food services positions. So we have food service aides as well as hosts and hostesses. So a lot of great opportunities, many different types of opportunities, and opportunities for people that even if you're right out of high school, there's some positions that you can jump right into here at the hospital as well. So let's get back into our interviews because we are going to highlight the positions available in another department, and that is our laboratory department. Okay, so our second guest today is Judy Craig, and she is our Director of Laboratory Services. And we really wanted to have Judy on as another guest because she also has a few great opportunities available in her department. So welcome, Judy.
Hi.
Hi. And how you've been with us? You haven't been with us for too long here at Morton Hospital. How long have you worked here?
It will be coming up a year in February 14th.
Okay, well, time flies when you're having fun, right?
Correct.
So tell us about your role.
So as laboratory director, I oversee the whole lab, meaning I oversee all departments in the laboratory. The departments including pathology, the core lab, which consists of chemistry, hematology, coagulation, and urinalysis. We also have blood bank, and we do a little bit of micro here. So I oversee all of the lab.
Okay, and you have a pretty large team. About how many employees do we have in the lab?
Oh, I have no idea.
Dozens, though, right?
We do. We have quite a bit. I would have to say, 40 maybe.
Yeah, it's a lot. And you have different section heads and different areas that help you, because obviously that would be a lot of people for you to manage all by yourself.
Correct, yeah.
And so you've been here for a year. What have you enjoyed most about working at Morton Hospital?
Actually, I love Morton Hospital. It's a family-orientated hospital, which I like because even though I've only been here at Morton for a year, I've been in the system, Stewart, for 27 years.
Oh my goodness.
So, and the hospital I transferred from, Norwood, was the same way. Smaller hospital, everybody's very friendly. When you walk down the hallway, everybody says hi. And I know this for a fact because in between Norwood and Morton, I went to St. Elizabeth's for a little bit, and it was a totally different feeling.
Yeah.
Coming from the bigger hospitals, it's just different. You're in your own little world. We're here, everybody knows everybody helps everybody, and I think that's what I like the most.
Yeah, and I think we get to establish a great relationship with our patients, too, because a lot of time the patients know the people, the staff, when they come in and expect to see them. So
Agreed.
All right, so let's talk about the positions that you have open in your department. So there's a couple that are similar, but let's walk through each of them. So one of them is a medical technologist. So what does that person do, and tell us about that position?
Okay, so a medical technologist is a laboratory professional. They can either have a 4-year degree or a 2-year degree. So a 4-year degree we call registered medical technician or technologist.
Okay.
The 2-year degree is an MLT. Either or, they do the same thing here.
Okay.
And what they do is they run the core laboratory. So they do hematology, chemistry, coagulation, urinalysis. They run the analysis. They do all patient testing. So if you get your blood drawn and you need to have like a cholesterol done, that's what they do. They test the blood.
Okay.
If you're having surgery and you need, you want to get set up for units of blood just in case something happens, that's what they do. They make sure the units match the patient.
Okay, so that's all done within the lab itself.
Correct.
So that's pretty much their primary area. They stay within the lab. Do they ever have to travel to different departments to do anything, or? That's probably another position that we're going to talk about shortly.
Yeah, that is. I mean, we do help out in IR. So people that get diagnosed with cancer and they have to have a bone marrow tested to see how advanced their cancer is, where it is. So we go and help the physician out with the collection of a bone marrow aspirate. So we do a little bit of outside the lab.
Okay, so 2 of the positions, one is the medical laboratory technician and one is the medical technologist. So the MLT is 2-year degree, you said, right? The medical technologist is 4 years.
Yes.
So you have one of each posted online. So are they full-time, part-time? Tell us about what the actual position entails.
So we have, for that position, we have a part-time 24-hour night position, meaning overnights, 11 to 7, with a rotating weekend, which we haven't figured out yet, and a rotating holiday schedule.
Okay. All right, so that's for both positions? They're both the evening shifts?
They're both the night shifts. It's
sorry.
different,
Yep.
yes.
Night
Evenings
shifts.
is 2:30 to 11. This is an overnight shift. We currently have a full-time overnight person that works full-time. We actually have 2 of them, but one's out on FMLA.
Okay.
So, but we need somebody else for when they take vacations or whatever, and sometimes it gets busy at night, and we just need that extra person.
Okay. So now these folks, if they're hired into the position, they obviously have gone to school for it. They know what to do, but there's got to be some sort of training involved, like a training period or initial orientation period here.
Yeah. So if they get hired into the job, there is a training. So we try keeping it at 3 weeks per section in the laboratory. So when you come in, you'll get 3 weeks of training in HEMA, 3 weeks of training in chemistry, 3 weeks of training in blood bank. Urinalysis, we do probably 2 weeks in urinalysis. It's not as extensive as the other departments. And then a week just overall for processing and any other things that they need to know.
Okay, great. All right, so now you have 2 other positions posted, and those are both a phlebotomist position. So I would imagine many listeners out there might know what a phlebotomist is, might be referred to as other terms in the general public, but tell us what a phlebotomist does.
So a phlebotomist is a person who draws your blood. So when you go to the physician and you need to get blood drawn, you see a phlebotomist. Here at the hospital, of course, the phlebotomist draws all areas in the hospital. So if you come into the ED or ER, the phlebotomist is there. They'll help draw blood down in the ER. On the floors, they draw blood. So they're the ones that actually collect the blood specimen from the patient.
Okay, and that is a special degree that they have to get also?
So yes, so phlebotomy, it's a class, certification they have to take. But they also can, and I forgot to say, for the med techs, we required our med techs here to be board certified.
Okay.
So they do need to have, they don't have to have newly med techs. We do accept them right out of school, but they have to get their certification within the year.
Okay.
For phlebotomy, we would like them to be board certified, but it's not necessary for them. We just require the certificate for phlebotomists.
Okay. So do they go to school to be a phlebotomist, or is it just
They do have programs. Coastal Career is one of them. BCC has a phlebotomy program they can take, and I think it's just like a 8-week course or 12-week course.
Oh, great.
It's not like a year-long course. It's just a course that they take. They come out of it knowing how to draw blood. They actually everything to do with blood, so that they are well aware. It's not just stick in, there you go. They have to know a lot of things.
Okay. Now, I know we have a great team currently, but I always see them running around. They're super busy, so that is why we need help in the phlebotomy department. I would assume that the staff in that area would agree.
Yes, we always need phlebotomists. We're quite busy. For a little hospital, we're quite busy, especially this time of year.
Yes. And they have, they travel around. You see them all in all areas. They cover a lot of ground in the hospital. They have their special carts that they go around with, which is very convenient. So it's not like they're just sitting in one area waiting for you to come in and they draw blood there. They are active all around the hospital. So I would imagine you'd want to have somebody that really likes to interact with people and, sort of a team oriented person. So tell me about the types of candidates that you look for when you are interviewing.
So for phlebotomy, of course they have to have the certificate, like I said. But we do take new phlebotomists. Granted, we would like to have a phlebotomist with a few years experience, but we are willing to give the right person a shot at showing us what they can do. And yes, they have to be person oriented. They have to be friendly, be outgoing. Work as a team is very important in phlebotomy because there are draws all over the hospital, ICU, the floors, the ED, outpatients. So they all work together to get these draws done in a recommended time period. I think that's probably it.
Okay, so I'm going to ask about phlebotomy, the training after they get hired, like I did for the MLTs and medical technologists. So they have their certification, but when they come on site, you don't just set them free and they go and do their own thing, right? So what's involved in the training?
That's correct, Julie. So for training, when they get hired in the position, we do have a training period. All phlebotomists or all new employees, whether you're a phlebotomist or a med tech, they get trained full-time days. Whether you're on day, second, or third shift. So we train you for phlebotomy. It's usually 3 weeks we train you because and that's another thing I forgot to tell you. Not only do they have to know how to draw blood, but we phlebotomists do other tasks too. So they need to know the computer. So our computer system is Meditech. So they have to learn Meditech. They need to learn how to short register patients because we get samples from the doctor's office outside and they drop them off and we have to short register them and order the blood work. So we give them like a 3-week training period, and then if you're a different shift, if you're like second or third shift, we give you another week training on your shift. It's basically the same. The workflow is a little differently from each shift to shift, and that's why we only give a week for on their shift, and then they start their position.
Okay. And now during, people that work off hours, evening shift, night shift, is there like a lead in certain areas that they can go to since you're not here 24/7?
So there is, there's whoever the tech in charge. So it's always a tech in charge for whether it's second shift or third shift. So if there's any issues, sick calls or issues on the floors or anything, they can go to the tech and the tech will take care of it.
Okay, good. So lots of support when you join. So, all right, great. So 4 great opportunities available with Judy and her team in the lab. So if you're listening out there, please come to our hiring event or register online. It's a walk-in also, and then you can also search for these job opportunities on our website, jobs.steward.org, and narrow down your search to Morton Hospital, and you can read a little bit more of the details and the qualifications needed for each of these. So great information, Judy. Thank you so much for chatting with us today, and let's hope that we can get you some good candidates.
Thank you, Julie.
All right, thank you again to our 2 guest interviewees today, Stacy and Judy, for taking the time to talk about the career opportunities in their areas. we are actually approaching the time that we have to take our final break of today's show. So we'll get right to that break, but when we come back, we will recap today's show, again, give you the information for our upcoming hiring event, and then also share a few other updates from the hospital. So stick around for our final segment. We will be right back after this short break.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
Need a primary care provider? Morton Hospital and Steward Medical Group have welcomed 3 new doctors to our community. Dr. Margaret Sywinska and Dr. Yelena Levin have joined our Steward Primary Care of Taunton practice located on Bay Street. For an appointment, you can call 774-501-3229. And Dr. Joanne Sylvia is now seeing patients at Steward Primary Care of Lakeville, seeing patients of all ages. For an appointment, call 508-947-4400.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Good morning, everyone, and welcome back to the final segment of today's Morton in the Morning show. Thank you so much for listening. We hope that you have enjoyed today's show. We were very happy to be joining you again with a new show for the new year, and we hope to bring you many more great new shows in the coming weeks. We are working on lining up some great interviews and some topics that we want to talk to you about. But again, at any time, if you have any suggestions for topics that you want to hear about, you can send us an email, share your feedback, share your suggestions. Just email us at mortoninthemorning@steward.org. That's MORTON in the morning at STEWARD.org. So today's show, we had 2 guest interviewees. We had Stacy and Judy from our imaging department and our lab department. They were talking about some of the open positions that they're looking to hire into in their departments. But today's show is really all about, as a whole, a hiring event that is coming up at Morton Hospital on February 7th, because we have so many career opportunities, got a lot of great positions open, and we want our community to join us at our hiring event. It is going to be on Tuesday, February 7th. It's a walk-in hiring event, but we do also encourage you to register in advance if you're able to do so. And you can register online. You can find the information about our event on Indeed, or the best way is to go to our Facebook page. If you're on Facebook, just search Morton Hospital, and we have that posted on our page as an event, but also a few different posts on our page where there is a link you can click right on to register for the hiring event and let us know what position you are looking to interview for. So again, the hiring event is Tuesday, February 7th. There are 2 sessions, a morning session from 9 a.m. to noon and an afternoon session from 2 to 4 p.m. It's right here at Morton Hospital, on site, in person. We are going to have managers here from various departments that have open positions to interview you on the spot and talk to you a little bit more about the position, and maybe even extend some offers in real time. So it's a great opportunity to get in the door here at Morton Hospital, meet your potential manager, and just give a great impression and possibly join our team. We've got lots of great opportunities available, both nursing and ancillary department positions. So lots of great opportunities. You can take a look at all of our available career opportunities on our website. You can go to jobs.steward.org, and then there's a couple drop downs where you can filter where you want to search. So if you just click on in the drop downs, the state is Massachusetts, the city or town as Taunton, and then it will list all of the open positions here at Morton Hospital in alphabetical order. So we hope you'll do that. Again, we hope you'll join us at our hiring event, but also you can apply online at any time on that jobs.steward.org website. Once you click on a position you're interested in, you can apply online right there on that page, and you can do that at any time, either before or after the hiring event. But again, we do encourage you to join us at our hiring event. A couple great incentives just to highlight for nursing positions. We are accepting new nurse graduates. Those are welcomed here at Morton Hospital. We have some special training programs to onboard you. We also have some sign-on bonuses available for new staff RNs. So if you're a new nurse here at Morton Hospital, there's a great sign-on bonus incentive. And then nurses in general who join our float pool. Our float pool is really nurses who float around the hospital. They'll be assigned to various units of the hospital wherever the greatest need is. So there are different shifts. They'll be on different units. And if you join our float pool, you'll earn an additional $7 per hour above and beyond your base pay. So that's a great incentive in itself. So again, please join us. You can either walk in at our hiring event or register in advance Tuesday, February 7th, 9 a.m. to noon and 2 to 4 p.m. right here at Morton Hospital. We hope to see you, and we hope you will spread the word to your family, friends, neighbors, or if it's yourself, please come on in and join us at Morton Hospital on February 7th. So a few announcements to close out today's show, and if you were listening last week, we did talk a little bit about some of our new providers, but I wanted to highlight them again because we have 3 new primary care providers that have joined us within the last 3 months. They are Dr. Yelena Levin, Dr. Margaret Sawinska, and Dr. Joanne Sylvia, and they've actually all joined us from Compass Medical, and they have joined the Steward Medical Group and Morton Hospital team. So Dr. Levin and Dr. Sawinska, they are actually now practicing at our Steward Primary Care of Taunton office. It is located at Northwoods Medical Center right up on Bay Street in Taunton. They are accepting new patients. They are both board certified in internal medicine and just great new additions to our team. So if you'd like to learn more about that office, which is brand new up at Northwoods Medical Center, you can call the office at 774-501-3229. Now those providers, they also do speak some other languages. So Dr. Sawinska speaks English and Polish, and Dr. Levin actually speaks English and Russian. And then Dr. Joanne Sylvia is the newest addition to our primary care team. She actually specializes in family medicine, so she sees patients of all ages. And she has joined our Steward Primary Care of Lakeville practice. That is located on Main Street in Lakeville. And Dr. Sylvia has a special interest in women's health, family care through all life stages, as well as chronic disease management incorporating lifestyle. So for more about Dr. Sylvia or to request an appointment with her, again, she sees patients of all ages, you can call the office at 508-947-4400. Again, that's 508-947-4400. So we're so happy to have those 3 new providers join our primary care team. Another announcement, and we will definitely do a future Morton in the Morning show all about this, but we have a new service or treatment that we are offering here at Morton Hospital. And you may have heard about it because it's somewhat new, but I know that they have some commercials on the radio, and it's really sort of an up-and-coming new therapy. It is called Inspire Therapy, and that is specifically for patients who suffer from obstructive sleep apnea. So it's a breakthrough treatment option, and a lot of the times it really benefits patients who cannot tolerate a CPAP machine. We will actually be the first hospital in the region to offer this new treatment option, and it involves an FDA-approved implantable device that actually prevents airway obstruction during sleep. So this program is really being spearheaded by our sleep medicine specialists and our ENT specialists. They work very collaboratively as part of the program to determine the patients that are eligible, to develop care plans, and also to manage any follow-up care after a patient receives this Inspire implant to ensure that they receive the best sleep. And again, all of us know how much sleep can impact our overall health and wellness. And there are probably many patients out there that have tried a CPAP machine. It's just not working for them. It's uncomfortable. They can't tolerate it. So this is really a great new option, and we are so pleased to be able to offer it here at Morton Hospital. Again, the first hospital in the region. We know that they do offer it at some Boston area hospitals, but especially in the South Coast area, we are going to be the first to offer Inspire therapy for obstructive sleep apnea. So very excited about that, and we will work on having a couple of our providers who are part of that program. Dr. Imad Bahadi, who is our medical director for our Center for Sleep Medicine, and then Dr. Amir Shah. He is an otolaryngologist or an ENT specialist, and he's actually the one that will be doing the implanting of the device here at the hospital in our surgery center. And he and Dr. Bahadi will work very closely, as well as the members of our sleep center, to determine patients who might be eligible for this breakthrough new therapy if you're suffering from obstructive sleep apnea. So again, looking forward to that, and we will certainly plan a future show and talk to you a little bit more about Inspire therapy, how it works, how safe it is, and how it might be able to help you or a member of your family. And lastly, we just again want to give a huge shout out to all of our staff here at Morton Hospital, our staff, our providers. We have earned the Joint Commission Gold Seal of Approval for Quality and Safety, which means we recently had some unannounced surveys here at Morton Hospital, both for our hospital program as well as for our behavioral health opioid treatment program, which is our MORCAP unit here at Morton Hospital. And we had those accreditation surveys, and we have passed those. We did wonderfully. We demonstrated exceptional care to our surveyors from the Joint Commission. And now for both programs, we have earned 3-year accreditation from the Joint Commission and have earned their gold seal of approval, which is nationally recognized. Hospitals that achieve the highest standards of care and meet certain qualifications and standards in terms of quality and safety. So we are very, very proud of our team. There's a lot of work that went into it, and a lot of work every day that goes into ensuring that we are providing the best possible care to our patients. Congratulations to our entire team. Thank you so much for all you do. And we are just very, very proud of all your work and the great care that you give to our community. So we are just about out of time. I know that I let everyone know how you can contact us here at Morton Hospital, but we will end the show with just another reminder how you can reach us if you have any feedback, if you want to let us know how you're enjoying the show, or if you have any suggestions for future shows. Again, I mentioned we do have some shows lined up talking about the Inspire therapy program for sleep apnea. We're trying to get some interviews scheduled with some of our new providers. But if you have a specific health and wellness topic that you want to learn more about, please don't hesitate to reach out. Email us at mortoninthemorning@steward.org. It's MORTON in the morning at STEWARD.org, and we will get back to you as soon as we get your email. So thank you so much for listening to us today. We hope you will join us next week. We come to you every Wednesday at 11:05 a.m. right here on WVBF, your hometown radio station. And again, please join us for our February 7th hiring event for all positions here at Morton Hospital. You can register, or you can just walk in and join us. Come meet our team and interview for a position that you are interested in. We hope to see you there, and we hope you'll tune in next week as you join us for Morton in the Morning. From all of us here at Morton Hospital, we hope you have a happy and healthy week, and thank you so much for listening. At Morton Hospital, we're proud to be nationally recognized for quality and safety. In addition to recently achieving the Gold Seal of Approval and accreditation from the Joint Commission, the Leapfrog Group has named us as a Straight A's hospital for having received 5 consecutive A hospital safety grades since 2020. To learn more about our achievements and awards, visit mortonhospital.org.